In today's video, we're going to go over what to expect when you go in for a colposcopy. Hey guys, my name is Diana and I'm a PA, which stands for physician assistant, and I specialize in women's health and gynecology. You are watching In the Pink, and if you're new to this channel, In the Pink means in good health and spirit. So if you like being healthy and being happy, remember to give this video a thumbs up and also hit the subscribe button and the little bell-shaped icon down below so you don't miss any other videos just like this one. So a colposcopy is a test your doctor or your PA or your NP, whatever you're seeing, your medical provider, might have to do if you have a Pap test or an HPV test that has come back abnormal or positive. It's a way for your doctor or your medical provider to closely examine your cervix. I'll go over what that is later, to see if everything looks okay or if they need to check a biopsy. If you are going to have a colposcopy, this video will go over what to expect when you get it done. So a colposcopy is a test that lets your medical provider closely examine your cervix. So your cervix is the bottom part of your uterus. It's located at the top of the vagina. So here's the vagina, this is the uterus, and here, right there, is the cervix. It serves as a conduit between your vagina and your uterus. In other words, it's like a tiny hallway from your endometrial cavity into the vagina. This allows blood from your period to come out, sperm to go in, and if you are pregnant, it stretches open for a baby to come out. So before going over what a colposcopy procedure is like, it's important to know why you need it and what it's for. So I'm going to talk a little bit about that right now. When you get a Pap test, you are testing your cervix, not only for cervical cancer, but also pre-cancerous cells as well. If you can catch cervical cancer very early, and even better, when it's only pre-cancerous, not full-blown cancer, it is way easier to treat, which is why getting your Pap smears regularly is so important. Some people don't have abnormal Paps, but they do test positive for something called HPV, which stands for human papillomavirus. HPV is a virus that's responsible for cervical cancer almost 100% of the time. Most of the time, your body's immune system can get rid of that virus on its own. But when it doesn't, and it infects your cervix for a long time, it can cause cancer on your cervix. So if you have a Pap test that comes back abnormal, or if you test positive for HPV, you will likely be asked to go back to your medical provider's office for a colposcopy. There are a few other reasons your provider might choose to do a colposcopy, but most of the time it's just for an abnormal Pap or a positive HPV test. So let's go over what to expect. First of all, what is a colposcopy? So in short, it's like a big magnifying glass or like a microscope that lets your medical provider take a really good close look at your cervix. When you get to your exam room, your provider will probably just want to talk to you for a bit. This is a chance for he or she to get to know your medical history. They might ask you if you've ever had an abnormal Pap before, if you've ever had cervical biopsies before, or if you've ever had genital warts before, or if you've had any other cancers in the genital tract. By the way, I did a video about cervical cancer. I'll put a card above here so you can click to that if you're interested in that. I'll also put that in the video description down below. They might ask you about previous pelvic surgeries, smoking history, because smoking increases your chance of developing cervical cancer, if you take any medications that might make your blood thinner, or if you have a bleeding disorder. The important thing to remember here is that they're not trying to embarrass you, they're not trying to judge you or anything like that. All their questions are simply to help make the best decisions for your medical care. After this, they usually step out and let you change. They let you keep your shirt on and usually just have you get undressed from the waist down, and then they'll give you a sheet or a drape or something to place over your lap. When they come back, they will have you lay down and put your feet up in the stirrups. Then they will put a speculum inside your vagina, just like they did when they collected your Pap test. This helps you see the cervix all the way inside your vagina. From here, they might use a cotton swab to apply a liquid onto your cervix. The liquid is called acetic acid. And don't be nervous because it has the name acid in it. It's actually just a fancy name for vinegar. This just helps them see anything abnormal a little bit more easily. Then they get the colposcopy and use it to look very closely at the cervix. Like I said, it's kind of like a magnifying glass. It shines light on your cervix as well so they can get a really good look. The colposcope, which is the instrument that they use to do the colposcopy, while it is used to be able to get a good close look at you, it doesn't touch you or your vagina or your legs or anything in any way. They just look through it to get a better look. So it shines a light on your cervix as well so that they can get a really good view of your cervix. Sometimes even changing the color of the light might help the provider identify abnormalities as well. If they don't see anything abnormal, then that's it. You are all done. But if they do see anything that looks unusual or abnormal, then they collect a small sample to send to the lab. This sample is called a biopsy. At the lab, a doctor who specializes in diseases, particularly what diseases look like under a microscope, called a pathologist, will look at your biopsy under a microscope to see if there are any precancerous cells, and if there is, how advanced it is. So many people will ask, does a biopsy hurt? So there's not a lot of nerve endings on the cervix, but when they get a biopsy, there's a small, quick pinch is what usually people say. Some people also say it just feels like pressure. Don't worry about that though. If you feel anything, it only lasts for a quick second and then it goes away. But if you are nervous, you can ask your doctor if you can take an over-the-counter pain reliever beforehand. But I personally don't think that's really necessary. After the colposcopy is done, you can get dressed and go home. If you get a biopsy, it usually takes anywhere from 1 to 3 weeks to get the results back from the lab. So try not to think about it or stress about it. When the doctor office calls you, they will tell you the results and what, if any, needs to be done about it next. It might feel scary to get a call saying that your pap is abnormal and that you need to go back for a colposcopy, but I want to emphasize you not to be scared. You're already doing the right thing because you went in to get a pap test in the first place. So good job for being responsible and proactive for your health. Your doctor will help you through this process, and hopefully the colposcopy will be normal and you can go home knowing everything looks good. But you will likely have to do more paps a little more often for a while. Your doctor will let you know when you can go back to regular pap testing intervals. So that's it. Thanks for watching this video. I hope it was informative for you. I hope if you had any questions that it answered it for you. If it did, please give this video a thumbs up and remember to hit the subscribe button. If you have any questions for me, put that in the comment section below, or if you have any other topics that you would like me to talk about, put that in the comment section below as well. Thanks for watching again, and here's hoping that everything in your life is in the pink.